Good afternoon, YouTube family. My name is Olutayo. I live in Maryland. Welcome to day 5 post robotic repair of uterine isthmocele. I feel better. I feel stronger. I feel like I'm recovering well, and I feel more rested today for returning back to work. So, in my previous video, I talked about my MRI and why I needed to do a surgery. So the result of the MRI indicated that I was actually menstruating, but the menstruation was not flowing out because in my previous deliveries I had C-section deliveries. So the C-section scar opened inside, and so it acted like a pouch that was retaining the blood, my menstrual blood. So for 2 years and 8 months, or let's say 2 years, maybe the period did not return, when it was supposed to return. Let's say the period started 2 years ago, and so my menstruation has been contained inside that uterine pouch, and it's just been accumulating itself inside that pouch for that long. My doctor was concerned, because when we did at the MRI, there was a measuring of the cyst. Remember in my previous video when I did the transabdominal ultrasound, it actually showed that there was a cyst-like mass formation somewhere around my right ovary. That was done 2 times, but there was no clarity on what it could be. Even after my doctor placed me on a medication for 21 days to help thicken the walls of my uterus, that after doing the test, taking the ultrasound after that 21-day period, it should give us a clearer image or better interpretation, but I did the ultrasound and the result was still as the first one. There was no clarity, so which necessitated the need for me to do an MRI. So the MRI now gave better clarity because, of course, there was a contrast in the MRI, so it gave a better imaging to the contents of the cyst. So it was interpreted that the cyst was actually filled with blood. So when my doctor saw that, she asked that I come see her immediately with my husband, and we went for that visit. On the day of the visit, she explained to me what has been happening inside. So apparently I menstruate, but it's not flowing out because of the isthmocele condition that had occurred, and in order to correct it, it has to be done through surgery. While I was doing my research, I did not come across anything like uterine isthmocele. What I came across that most women, that was out there on YouTube in the course of my investigation and worry, was a need for hysterectomy by women because they were having heavy period, or for some who had fibroid and needed to remove it. It was done through maybe total hysterectomy or laparoscopic hysterectomy. And I was wondering what kind of repair, what kind of treatment I was going to do, to resolve this issue, even before my doctor asked us to come see her. So I was kind of trying to prepare my mind, like what could be wrong, what could be the solution, what kind of treatment and all that would be done. So when we went to see the doctor, and then she told me that I'll have to do a surgery, I asked what kind of surgery, and she said laparoscopic um, cervical isthmocele. It wasn't even clear to me at that point. I'm like, no, I don't have a fibroid. And she said, no, you don't have a fibroid, but it is similar kind of procedure, just that in your own case, we are dealing with an isthmocele, but for someone dealing with fibroid, we are working to remove fibroid. But it's kind of the same technique, the same treatment, but at the end of the day, it's a similar result you would get. So at the end of the day, the result is for this to be resolved, and for whoever has fibroid, for their fibroid to be removed. And for those who have very heavy menstruation, it's either they actually do the same procedure to correct or to remove whatever is causing them that. So I was kind of worried about it, and then she actually told me that it was going to be a pelvic examination under general D&C, robotic repair of uterine isthmocele with possible ovarian myomectomy. All that was confusing to me. And then the risk involved is pain, bleeding, infection, injury, laparotomy, hysterectomy, blood clots, infertility. Infertility because in the course of the repair, there's a possibility that based on whatever she meets at the point of surgery would determine if she will have to remove my uterus. So she had prepared my mind, at that time, to say this and that might happen in the course of. That was at the back of her mind. So that was why I needed to do a surgery. I'm putting this out there because while I was doing my search, I didn't come across people, specifically Africans, Nigerians, talk about this. So maybe I'm the first Nigerian coming to give my account, to give my own story, to let people know of my journey. But I feel like this is something common, and most people might not even know that they are going through something like this. Because for a woman who is not menstruating, while I was in that situation, the reason I was concerned was because I was feeling menstruation inside, but nothing was coming out. But at the point, I stopped feeling that way, So I could have just assumed that everything was fine since I didn't have any symptoms. There was nothing wrong with me. I was healthy. I was up about my business like everyday life. There was really nothing different about me. The only thing different was that I was not menstruating. But then that's not supposed to be something to worry about. So many women, some women might actually be going through the same thing, but they don't know that it is a problem. Now it's a problem because when we went for that last visit, when my husband and I went to see the doctor to explain the result of the MRI, she said I needed to do the procedure as soon as possible, because from the size of the isthmocele, it was 7.5 by 3 point something by 6.8 cm, which is big. And she said there's a possibility that if it is not treated on time, if it keeps accumulating and containing blood, it could rupture, and we don't want that to happen. So she needed me to do it as soon as possible. And I was so lucky because as at that day, she told me she was fully booked up until June 18th for surgeries, that the available time was after June 18th. But after we left her, I got a call from our office, I think that same week, because we went to see her on a Monday. The same week, on a Thursday, I got a call from our office saying there was an availability for February 20th. You know, a slot was open for surgery for that day, and she was like, am I willing to, have I thought through it? Am I willing to do it? And I knew the impact, knowing that this thing is big already, and I didn't want a problem. So I needed to quickly, take the opportunity of that day and do the surgery. And we agreed to do the surgery, and luckily for us, it was very successful. Like I said, today is day 5 after my surgery. I'm doing well, and I give glory to God. I would come back again to continue this series by discussing on what I needed to do before surgery and how I've been taking care of myself after surgery. So if this is what you're interested to hear and you have any question, please do well to leave it in the comment section. Thank you very much for listening. It's your girl, Olutayo, and I'll see you in the very next one. Bye for now.